The healthcare team. Who does what? Sometimes to understand where we're going, we need to understand where we came from. In early history, evidence suggests that coaches, physicians, and therapists existed in ancient Greek and Roman civilizations. These individuals functioned to aid athletes in reaching top performance, mostly in Olympic sports. Early treatments involved rubs, counter irritants, home remedies, and even poultices. Sports medicine is a wide umbrella. It's a broad field of medical practices that are related to physical activity and sport. This involves a number of specialties involving active populations. Areas of specialization under the sports medicine umbrella are typically classified as related to performance enhancement or injury care and management. The areas of specialization under performance enhancement are exercise physiology, biomechanics, sports psychology, sports nutrition, strength and conditioning, coaching, and personal fitness training. The areas of specialization under injury care and management are the practice of medicine, athletic training, sports physical therapy, sports massage therapy, sports dentistry, osteopathic medicine, orthotics or prosthetics, sports chiropractic, sports podiatry, emergency medical technician, and paramedics. You, as a kinesiology student, may find different areas that you're interested in. You might find that you're more on the performance enhancement side of sports medicine, or maybe on the injury care and management side. The sports medicine team should center around the athlete or our patient. The sports medicine team typically includes the team physicians, parents, coaches, and athletic trainers. Athletic trainers must keep parents informed, particularly in the secondary school setting. They are responsible for injury management and prevention techniques. The parent's decision regarding healthcare must be a primary consideration. Insurance plans may dictate the care or the selection of physicians that are available for treatment. The athletic trainer, physician, and coaches must all be aware and inform parents of Health Insurance Portability and Accountability Act, also known as HIPAA. This regulates the dissemination of health information and protects the patient's privacy and limits the number of people who could gain access to medical records. An athletic trainer works under the direct supervision of a physician. The team physician assumes a number of roles and serves to advise and supervise an athletic trainer as well as other people. Physicians and the athletic trainer must be able to work together and should have similar philosophical opinions regarding injury management. This can help to minimize discrepancies and inconsistencies in treatments. The team physician is responsible for compiling medical histories and conducting physical examinations, including a pre participation screening. They also are involved in the diagnosis of injuries and deciding on disqualifications. The decision regarding an athlete's ability to participate should be based upon medical knowledge and the psychophysiological demands of the individual's sport. Team physicians should attend practices and games. They should be committed to sports and the athlete's overall health and well being. They must understand the specific role of all individuals involved with the team. Coaches must clearly understand the limits of their ability to function as a healthcare provider in their respective state. Coaches also have a direct responsibility for injury prevention. All athletes must go through appropriate conditioning programs for their respective sport. Coaches must be aware of the risks that are associated with specific sports and should provide appropriate training, oversight, and equipment. Coaches should be certified in CPR and first aid practices. All coaches should have a thorough knowledge of the skills, techniques, and environmental factors associated with sport. They should develop a good working relationship with staff, including the athletic trainers. All of these relationships are important for the overall health and well being of the person at the center, the athlete or the patient. In addition to our sports medicine team, there are supportive healthcare services and personnel. All of these professions help to support athletic populations and sport participants in different ways. So it's important to include them as they may be a secondary level of the sports medicine team. In treating active populations, there are some special considerations. When we think about traditional athletic activity, we're typically thinking about organized sports, things like basketball, football, baseball. But that isn't always the case. We have different types of athletes, including athletic activity as well as recreational activity. Recreational activity is sometimes less organized or may involve individuals that are slightly less trained than athletic activity participants. All activities require physical skills that utilize strength, power, endurance, speed, flexibility, range of motion, and agility in different ways, so it's important to understand the differences. There are specific populations that we need to consider as well, such as the adolescent athlete or the aging athlete. The adolescent athlete may focus on organized competition. There are a number of sociological issues that are involved, such as how old or when should a child begin training. We need to consider the skeletal immaturity that presents some challenges with respect to healthcare. Physically and emotionally, adolescents cannot be managed the same way as adults, so those are important things to consider as well. The aging athlete. Physiological and performance capabilities change over time. The function will increase or decrease depending upon the point in the life cycle of the individual. This may be the result of both biological and sociological effects. It is important to understand that high levels of physiological function can be maintained through an active lifestyle, and the impact on long term health benefits have been documented for individuals who engage in exercise later in life. Beginning an exercise program should be of concern for aging athletes. Exercise programs should be gradual and progressive as long as no unusual signs and symptoms develop. All individuals over the age of 40 should have a physical exam and exercise testing before engaging in an exercise program. Another consideration is the occupational or industrial athlete. Occupational, industrial, or worker athletes are involved in strenuous, demanding, or repetitive physical activity as part of their daily activities for work. This may result in accidents or injuries. Our job as healthcare professionals may be to instruct on ergonomic techniques to avoid injury associated with the physical demands of the job responsibilities, or to intervene when injuries arise, correct mechanics, faulty postures, strength deficits, or even lack of flexibility. Injury prevention is critical for all of these aspects. Some things that we will discuss throughout this course are injury prevention and wellness promotion. A primary focus for the healthcare team is injury prevention and wellness promotion. Our job is to ensure a safe environment, conduct pre participation physical exams, develop training and conditioning programs, select and fit protective equipment properly, explain important diet and lifestyle choices, and ensure appropriate medication use while discouraging substance abuse. Depending upon your area of focus for the allied health profession, you may be involved in one or more of these areas. Additionally, clinical evaluation and diagnosis. This is recognizing the nature and extent of injury. This involves both on the field and off the field evaluation skills and techniques. We need to understand the pathology of injuries and illness and refer to medical care or referring to supportive services when warranted. Immediate and emergency care. This may include the administration of appropriate first aid and emergency medical care, such as CPR or AED usage. Treatment and reconditioning. The rehabilitation program design, supervising rehabilitation programs when an athlete is injured, incorporation of therapeutic modalities in exercise, and offering psychosocial interventions. And lastly, organizational and professional health and well being. This includes record keeping, ordering supplies and equipment, establishing policies and procedures, and supervising personnel. As we start talking about injury prevention and care, we need to talk about responding to emergencies. An emergency action plan is a plan that we have in place in the case of an emergency. Accessibility to phones in all major areas of activity is a must. We should be able to contact outside emergency services and call for additional help or assistance. Cell phones provide a great deal of flexibility in this area. Emergency action plans should include personnel in the chain of command. An emergency action plan is a developed plan to manage and mitigate the dangers of catastrophic injury in sports. It is currently unknown if high schools are appropriately following best practices in emergency management according to the Corey Stringer Institute. Corey Stringer is a premier institute for heat illness and sports related injuries. The failure to enact or develop an emergency action plan can be considered negligence. 425 catastrophic injuries resulted in permanent disability, and 4% of sport related deaths in 2013 were youth athletes under the age of 17. We need to make sure that we are ready for emergency situations and ensure that appropriate care is provided in a timely manner. This decreases the chance of legal action taking place and protects the liability of all individuals involved. The components of an emergency action plan should be specific to each venue and include maps and/or specific directions to that venue. On-site emergency equipment that may be needed in an emergency situation should be listed. The emergency action plan should identify personnel and their responsibilities to carry out the plan of action with a designated chain of command. Appropriate contact information for emergency medical services, facility address, location, and contact information should be identified in the emergency action plan. The plan should specify documentation actions that need to be taken post-emergency as well. The emergency action plan should be reviewed and rehearsed annually by all parties involved. Healthcare professionals who will provide medical coverage during games, practices, or other events should be included in this practice. Another way to limit our liability is by conducting pre-participation physical examinations. As part of the PPE, or pre-participation physical examination, a medical history is completed. A medical history is completed before the examination to identify past and existing medical conditions. This should be updated yearly and closely reviewed by medical personnel. This collects medical release and insurance information at the same time. The next step is the physical examination and should include assessments of height, weight, body composition, blood pressure, pulse rate, vision, skin, dental, ear, nose, throat, heart, and lung function, the abdomen and lymphatic, genitalia, and maturation index. Next is the orthopedic screening, which may be part of the physical examination or could be a separate evaluation process. A wellness screening should be used to determine if an athlete is engaged in healthy lifestyle behaviors. This should include questions about diet, rest, exercise and weight control, and lifestyle habits that pose a threat to wellness, such as alcohol, drug, tobacco use, and stress. The health maintenance and personal hygiene screening should include questions about skincare, dental hygiene and dental care, sanitation, immunizations, avoiding infectious and contagious diseases, and sleep habits. Certain injuries and illnesses may warrant special concern. Potential disqualifying factors should be determined during the pre-participation physical examination. It is important to note that pre-participation physical examinations are not conducted to actually disqualify individuals from sport. Rather, the purpose of a pre-participation physical exam should be to allow an individual to participate at their highest level. We should be identifying factors that are modifiable, such as getting an athlete glasses, or other modifiable factors that would help an individual participate at the highest level. Sports disqualification are rare and should be taken seriously.